If you're over 60, there's a silent habit many people do each night that could be quietly increasing your risk of a deadly health crisis. Not through cigarettes, alcohol, or sugar, but through something seemingly harmless, your evening routine. In fact, many seniors unknowingly trigger dangerous blood pressure, spikes, or heart issues while they sleep, all because of one overlooked factor: the timing of their medication. As a practicing cardiologist with decades of experience, I've seen too many older adults suffer sudden strokes or heart arrhythmias without warning. They ate well, walked daily, avoided smoking, and still ended up in the ER. What was the hidden trigger? Improper medication timing. Yes, the time you take your pills could determine whether you wake up feeling fine or don't wake up at all. Today, I'm going to walk you through 5 common medications taken by older adults that may be harming you if taken at the wrong time, especially before bed. If you take blood pressure pills, cholesterol meds, sleep aids, or even certain supplements, this video could truly save your life. Before we dive in, let me ask, have you ever thought about when you take your medication? Or do you just follow the label without thinking twice? Type 1 in the comments if you've considered the timing, and 0 if it's never crossed your mind. If heart health and longevity matter to you or someone you care about, please like this video and subscribe, your trusted source for simple, science-backed health tips for older adults. Let's begin with one of the most widely prescribed medications for people, over 60 blood pressure pills. Many seniors take them right before bed, assuming it helps keep their pressure low overnight. But what they don't know is that for some types of blood pressure, medications, especially diuretics like hydrochlorothiazide or furosemide, this timing can be dangerous. Take Mr. Alan Turner, a 68-year-old retired firefighter from Minnesota. He was active, followed his doctor's advice, and took his water pill every night after dinner. A few months in, he began waking up, dizzy, lightheaded, and even fell once in the bathroom. He shrugged it off until one night he fainted and hit his head on the bathtub. Tests revealed his blood pressure was dropping too low in the early morning hours, creating a high risk of fainting, stroke, or even heart failure. Why does this happen? Diuretics make you lose water and salt through urine. Taking them at night means your body is being drained of fluid while you sleep. And since blood pressure naturally dips at night, this can lead to dangerously low levels. Plus, frequent trips to the bathroom at night increase your fall risk. Alan now takes his medication in the morning, and the fainting spells have stopped. Type BP in the comments if you're on blood pressure, medication, and check with your doctor about the best time to take it. Next, let's talk about cholesterol medications, especially statins. You might have heard that statins work best at night because your body produces the most cholesterol while you sleep. While that's true for short-acting statins like simvastatin, it isn't the case for longer-acting ones like atorvastatin or rosuvastatin, which many older adults are now prescribed. Taking these long-acting statins at night may do more harm than good, especially if you're already dealing with muscle cramps or insomnia. Let me tell you about Ms. Brenda Lopez, a 72-year-old retired teacher from California. She was put on atorvastatin and told to take it with her evening meds. Within a week, she noticed aching muscles, restlessness, and vivid nightmares. Her doctor thought it was anxiety until we changed her statin timing to the morning. Within days, the side effects improved dramatically. For many people, taking statins in the morning minimizes their impact on sleep and reduces muscle side effects. If you're unsure which type of statin you're taking, ask your pharmacist. And if you're experiencing side effects like muscle pain or disturbed sleep, your timing might be the problem. Type ST in the comments if you're taking a cholesterol medication, and let's start the conversation. Now let's talk about sleep aids, especially melatonin. This one surprises most people. Melatonin is marketed as a natural sleep helper, and many older adults take it without thinking twice. But timing is everything. Melatonin isn't a sleeping pill. It's a hormone that tells your brain it's nighttime. The problem? Taking it too late can backfire. Mr. Robert Grant, 75, began taking melatonin at 10:30 p.m., hoping to sleep better. But he found himself groggy in the mornings, disoriented if he had to get up at night, and even started tripping on his way to the bathroom. The culprit? He was taking melatonin too late in the evening. It takes time to build up in your system. For best results, melatonin should be taken 1 to 2 hours before your planned bedtime. Taking it too close to bedtime or in the middle of the night can shift your internal clock the wrong way and increase your risk of early morning. Disorientation, a serious risk if you live alone or have balance issues. Robert now takes his melatonin at 8 p.m., sleeps more soundly, and wakes up clearer. Type M in the comments if you've ever taken melatonin, and always follow the right timing. Next up, aspirin. Yes, the humble aspirin, often prescribed to prevent heart attacks or strokes. Many people over 60 take a baby aspirin each day because their doctor told them to. But what most don't know is that when you take it matters too. Recent studies have shown that aspirin may be more effective and safer when taken at night. Why? Because the risk of heart attacks and strokes tends to peak in the early morning, hours around 6 to 10 a.m. Taking aspirin at bedtime may help thin the blood during this vulnerable window, offering better protection. It may also lower nighttime blood pressure, but this doesn't apply to everyone. Aspirin can irritate the stomach lining, so those prone to acid reflux or ulcers may do better. Taking it in the morning with food. Let me tell you about Mrs. Sheila Peterson, 70, who had a minor stroke 2 years ago and was advised to take a daily low-dose aspirin. She used to take it with breakfast until her cardiologist suggested trying it at night. Since making the switch, her blood pressure improved slightly, and her morning headaches disappeared. Always talk to your doctor before changing aspirin timing, but know that nighttime may offer additional protection. Now for the final one, magnesium supplements. Magnesium is an essential mineral involved in hundreds of body functions, from muscle relaxation to blood sugar control to brain health. Many older adults are deficient in magnesium, and taking a supplement can help. But when you take it, can change everything. Mr. Eugene Walker, age 66, began taking a magnesium supplement after experiencing leg cramps at night. He started taking it right before bed, thinking it would help him sleep. But instead, he began waking up groggy with an upset stomach and felt off in the mornings. Turns out, magnesium can cause a drop in blood pressure and also acts as a natural laxative in some forms. Taking it too close to bedtime can lead to nighttime bathroom trips, dehydration, or morning fatigue. For most people, the ideal time to take magnesium is with dinner. It helps calm the nervous system in time for sleep without disrupting it. Type MG in the comments if you've ever taken magnesium, and always choose a high-quality, easily absorbed form like magnesium glycinate or citrate. So what can we learn from all this? When it comes to medication and supplements, timing is not just a detail, it can be a matter of life and death. As we age, our bodies process drugs differently. What worked at 40 may not be safe at 70. Blood pressure pills, cholesterol meds, melatonin, aspirin, and magnesium are all tools for better health. But used at the wrong time, they can backfire. That's why awareness is the best medicine. Let's review the ideal timings. Blood pressure pills, especially diuretics. Morning. Statins long-acting types, morning. Melatonin 1 to 2 hours before bed. Aspirin, consider nighttime with your doctor's advice. Magnesium with dinner. Making small adjustments in your routine could protect your heart, brain, and balance. It costs nothing, but the rewards can be life-changing. If you learned something new today, please share this video with someone you care about. Type health in the comments if you're ready to take charge of your timing. And if you haven't yet, like this video and subscribe to HeartWise Daily for simple, real-world tips to help you live stronger, longer, and smarter after 60. Your health is your most valuable asset. Let's protect it, one smart habit at a time. You are not alone on this journey, and you're never too old to reclaim your health. Until next time, take care and be well.